Hello, everyone. Welcome to the 18th session of ISSUP Nigeria Chapter Bi-Monthly Webinar, which is tagged Knowledge Update. My name is Martin Agoje. I'm the National President of ISSUP Nigeria Chapter. Today, and as part of activities to commemorate the 2023 International Day Against Drug Abuse and Illicit Trafficking, we shall be discussing prevention. Precisely, we shall be looking at driving change through addiction prevention advocacy, strategies for lasting impact and effective messaging. And to lead us in this discussion is Dr. Tajudeen Abiola, while Ejikeme McBishop Guje will be moderating this session with me. Ejikeme is the Assistant General Secretary of ISSUP Nigeria Chapter. Before I invite Ejikeme to introduce the speaker, let me once again appreciate you for joining this webinar, and to please remember to send your questions while the presentation will be going on. Use the chat box to send your questions as I invite Ejikeme to introduce our speaker for today. Ejikeme, over to you, please.
Okay, thank you so much, Dr. Martin, and to all our esteemed participants. Here is a brief introduction of the presenter today, Dr. Tajudeen Abiola. Dr. Tajudeen Abiola is an accomplished mental health specialist who has dedicated his career to mental health promotion, addiction prevention, and public health initiatives on a global scale. With his extensive background in psychiatry and psychotherapy, he is committed to combating addiction and improving mental well-being worldwide. Currently serving as the head of clinical services at the Federal Neuropsychiatric Hospital, Kaduna-Nigeria. His research on effective intervention strategies contributes to evidence-based practices in managing psychological trauma and preventing addiction. In his roles as the head of the scientific board and National Secretary of the Green Crescent Health Development Initiative, GHI, he spearheads addiction prevention programs and collaborates with multidisciplinary teams to address addiction-related issues in communities. He also leads nationwide efforts to combat addiction and develops capacity-building programs for community groups focused on youth development. Dr. Abiola actively coordinates collaborative efforts among local and international medical professionals through the IMAN addiction working groups. He fosters partnerships and advocates for preventive measures to address addiction challenges globally. Dr. Abiola has many publications on mental health issues, addiction prevention, and psychosocial interventions to his credit. He has secured grants and currently collaborates with ECHO as a co-principal investigator on the Bridging the Childhood Epilepsy Treatment Gap in Africa BRIDGE project, which aims to foster international partnership and improve child care. He is a member of the International Society of Substance Use Professionals, ISSUP, among other professional bodies. I would like to bring on board the presenter for today, the person of Dr. Tajudeen Abiola. You are welcome, Doc.
Thank you very much for having me. Thank you, Dr. Martins, and thank you, Olivia. This afternoon, I will be talking about driving change through addiction prevention advocacy, strategies for lasting impact and effective messaging. These are the agenda I hope to achieve during this presentation, to give us what the objectives of what this presentation is about, provide a basis for which you can look at what addiction prevention entails, briefly discuss what are the models that exist when it comes to prevention generally and how we can link this to addiction prevention. Why do advocacy matters? Because this will take us to the needs, to the center of what this talk today is about. And once we understand that, they will look at what are effective strategies to achieve and to move forward in carrying out evidence-based advocacy. And I will try to give us a tidbit, just some glimpse of what addiction prevention campaigns should sound like or should look like. Then I'll provide some tips on moving on. Then we can summarize and conclude and move to questions and answers. To start with, the objective I hope this presentation today will achieve is to highlight the needs for addiction prevention and why it is cost effective to have this, and to also bring to us insight into the models of addiction prevention models and how these frameworks are relevant if you must carry out effective prevention strategies. Also to highlight pitfalls in addiction prevention campaigns and to advance knowledge on the do's and don'ts of prevention advocacy, and to also emphasize that for addiction prevention advocacies to succeed, they must be age appropriate. The message must resonate with the target audience, and this will only resonate, must also engage them so that we can use those peers as our co-workers in order to achieve successful addiction prevention campaigns. What are the understanding of what addiction prevention is? By definition, it is all measures that we can engage with or utilize to prevent or delay the onset of drug use or other addictive processes like behavioral addictions and all other process addiction, so that we can all reduce the transition to drug use disorders. So any effort to make on this line will help us or would serve as a definition of what addiction prevention is about. And why do we need this? Evidence have shown that alcohol and drug use disorders have been identified as the major cause of disability worldwide, and they contribute to 1.3% of DALI. And based on this, if you can see the impact of the body, then it is worthwhile to see that we prevent it. And that is it cost effective to prevent addiction, or we should target only treatment? And evidence have shown for every dollar invested in prevention compared to treatment, we save $18 when we do prevention. And when we do treatment, we save about $12. So it's still much more cost effective to spend $1 targeted toward prevention, because the benefit is huge in terms of challenges that will arise as a result of crime, the lost work that will occur, the reduced productivity that exists in the society, and the healthcare consequences of letting addiction take over the life of individuals that are predisposed or suffering from them. And all this are emphasizing the international policy on crime prevention that shows that 1/3 of all the efforts that is needed to prevent crime and violence is to see that we successfully prevent the onset or the use of addiction and addictive processes. The models of addiction prevention, you typically use two basic ones. And the common general one is what we call the Levels and Clark's model, which we know and is common for everybody to call our primary prevention, second prevention, and tertiary prevention. But this talk will be looking more about the primary prevention, where we'll talk about health promotion and specific protection to see that we can help people not to fall victim to the scourge addiction in the society. And the model that will help us to appreciate what primary prevention, how it works more, is to look at the modification brought by International Organization of Medicine when they look at their model. And their model talks about to promote well-being and health, to look at universal prevention, to look at selective prevention, and look at indicated prevention as a case against treatment and recovery, which are secondary and tertiary prevention. And so we are looking more of the primary and the promotion aspects of this talk. And that's why the model is telling us and guiding us to show that this talk is going to focus on us to try to prevent addiction, especially before it ever happens. So moving on, what are the relevance of this prevention model as it relates to effective prevention strategies? Three things do pop up. One, they provide a comprehensive framework for developing and implementing effective prevention strategies. Prevention program, when incorporated into the element of this program, are found to be very successful. That's why the model is something that we should never look down upon, and we should use them to our advantage. And research have documented that by mixing several elements of the primary prevention, that's whether we are using a universal educational approach and we are also using a targeted intervention for high-risk people, for instance, it has been found that they are very successful and they work best rather than use one of those prevention, whether they are universal, indicated, or targeted. So by looking at the various groups we intended to carry out prevention activities and looking at their peculiarities, we'll find a mixture of them, and it's good to make this model if we want to carry out successful addiction prevention activities. Why do we need addiction prevention advocacy? Two things typically pop up, but they are more than that. This one is to facilitate change, because without carrying out addiction prevention, it will be difficult to help people to appreciate the effort to shape public policies that will be geared toward improving the public well-being, to increase the health of the community. And in order to achieve this change, the addiction prevention control with targeted policies, it will help to raise public awareness. And by that way, it will reduce the rates and related harms that will come from addiction and related activities. Two, it also brings impact, because research have shown when addiction prevention campaigns are successful, from one of the studies carried out some years ago, which are very vital study up to today, it reduced social issues that are related to addiction, such as about 30% reduction in drunk driving fatalities over a 10-year period. And this shows that if you succeed in carrying out addiction prevention campaign, we are adding more value to the well-being of the society, and not just only the individual. If you find, as we see, addiction prevention is very vital when we are looking at the total well-being of the community. But the way we carry them out matters, and that is what this slide is telling us. Many efforts have been made, but most of those efforts usually fail, and that is the question this slide is asked. And it has shown us that yes, most failed due to some of these reasons. When we carry it out and we refuse to foster self-awareness in the individual that we're carrying out this process with, this intervention for, we cannot help them to be aware of themselves, to appreciate what is going on. Most likely, the efforts we are making in order to prevent them from starting might be counterproductive. Another reason will be when we promote focusing on other people's goals rather than the goal for these people that we are targeting, that we are carrying out this addiction prevention program process for, then it's likely that that thing we're doing is likely to fail. The intervention might not work for them. And also, when we try to downplay why addiction and other processes related to this is attractive to young people, then we might fail in our objective of carrying addiction prevention program programs, intervention campaigns, because we know due to marketing activity, addiction are presented as a cool thing, and that's why often celebrities are made to participate in the advertising process. And so we should not try to downplay this, because the way to downplay it, the effort we are making is not likely to succeed. Another thing we may also that may make our addiction prevention process fail is when we make healthy role model unattractive, and we make unhealthy role model attractive. For instance, there are differences between being a celebrity and being an hero. And the moment we mistake or misinformed or malinform people to make them think that being a celebrity means the individual is an hero, then we have changed the concept of what a healthy role model is. And to the young and to other people that we're trying to let them see the reason that being a celebrity and suffering from addiction synonymous, then we're changing the narratives to an unhealthy process. And that's why it's very vital. We should try to see that we delineate very carefully the difference between being a celebrity and being a hero, and those who serve as our healthy role model, the heroes. And when we employ poor educational approaches, that also can lead to failure, especially when we use labeling people. And also when we interpret what addiction is as sort of a spiritual problem, which generally is a big challenge, especially it's global all over the world, but we have more of such problems in developing and developed in the middle and low income countries, where most of what happens, especially in the mental health realm, are usually given that single title as a spiritual problem. Of course, it might be related to the issue of stigma, but despite that, if once we give it a wrong label, then people might not see the need that this is a brain disorder, a brain disease that needs intervention, because people can hide under that umbrella for spiritual attack, and yet they will not look for the right treatment. And any wrong treatment offered will worsen the situation. And also another thing that will come from poor education approach is that people often mislabel happiness as getting high, as using those substances. And those are some of the misinformation or malinformation that might come. And that is why our approaches should be careful in how we present the understanding and the knowledge that surround addiction and addiction prevention efforts. And when we present use of addiction process as the right coping processes, we know, and one of the things usually taught to most people that are in this field is use of addiction is a maladaptive process, a wrong way to cope. And we need to be very aware of this over and over so that we don't make that mistake when we carry out addiction, or else it might fail. And when, lastly, which is very vital, when our approach is just to go and copy and paste without looking at the cultural issues that are sensitive and specific to the group we are talking with, or we are interacting, or we are targeting, and to the community, and to the general societal view about this, without taking those into consideration, then our efforts to prevent addiction might fail, and most likely not. But when do we succeed is when we employ effective strategies in order to tackle addiction prevention activity. And this is especially more successful when we use them at community level advocacy. And that is by incorporating, by utilizing, and by pushing forward evidence-based approaches to negotiate with decision makers, to use evidence to negotiate with the target group, to help them to see that when we utilize the right approach based on scientific evidence, then we are likely to succeed. So why do we need to employ evidence-based strategies for prevention advocacies? The main reason is that one of the most commonly used approach is through communication. And because communication serves as the heart of addiction advocacies. And we will appreciate this more when we understood that communication, the way it is defined, is supposed to serve some purpose, because it's an intention to transmit information to others. And by that way, it's subsumed 3 essence. 1, we want to pass knowledge in order or to modify how people feel about certain things. 2, we want to know what's happened when we pass this message to people, how it affects their mood, and does it bring about a change in their attitude or otherwise. And 3, how does this communication get it used in order to accomplish the targeted end? Once we're able to successfully do, especially this 3rd aspect, we're likely to be doing the right thing in order to succeed in using effective strategies for prevention advocacies. Because when we use the affect and attitudinal-based knowledge, then this will help us to see that we are doing the right thing. And to do that, it is the evidence that will help us to show, oh, this is the right affective and attitudinal-based knowledge that we can apply. That when we apply them and utilize them, then we are doing the right thing, and this will help. And it is this that will take us to what those strategies are, which we simply, as time goes on, see as what are the do's and don'ts of addiction prevention campaign when we are carrying out advocacies. And in order to appreciate effective strategies for advocacies, we need to appreciate things that if you put in place, it's going to really work well for that, using those evidence-based approaches. 1, for generally as a rule, for any prevention advocacies, we need to make the importance of the message very clear and should be rooted in evidence, scientific evidence. 2, promotion messages, when not clear, specific, and guided by evidence, then it's likely to be counterproductive. I responded earlier, and that is why doing this, we must make sure our messages are not vague and they are not overgeneralized in order to succeed in bringing out this. 3, like I pointed out, it must be culturally sensitive or otherwise advocacy might fail. 4, cultural sensitivity prevention programs are more effective in reducing substance use rates and more specific in group. 5, the willpower of real life examples and peer messages are very vital, because evidence has shown when we use peer-led programs, they can be highly effective, as young people are often more receptive to messages come from their peer. So having understand this, then we can go to those evidence-based addiction prevention advocacies, the do's that guide them. And these things are not just mere thinking, they are based on understanding from evidence of saying they are very vital. Whenever we want to carry out prevention, we should, like I said, the art of every advocacy is communication. Then we must try to achieve this. We must present our talk based on facts. And when we are not sure what it is, we should be ready to say, I don't know. Because then people will find it valuable and they will know you are not in the process or in the way trying to manipulate them. And we should not try to invent facts when we don't know, because that's why it should be based on scientific evidence. And saying no will simply help cool down the situation, because we can always look for and represent to people, and that way we get them as partners and we get them to move together in order to succeed in improving the well-being of the community. And also, we should try to impose our own views and beliefs and ideas on the targeted audience in the way we communicate those facts. We should present the fact, and that way people will be able to appreciate it rather than trying to interpret it based on our own view. The second rule that is very vital, which serves as evidence of addiction prevention, is what is the aim of the conversation we are bringing about. And we should try to always remember we are focusing on 2 main things. We want to inform people so that we can change their attitude, and we want to provide a safe space that people can discuss so that they can appreciate that what is being carried out is for their well-being of the individual, the family, and the society. And when we are informing to change attitude, we should focus the information we are bringing, the change information, on addiction normative symbols, disease, events, and institutions. And when we focus on that, it helps people to see. For instance, we know the addiction industry exists, but what do they symbolize? They symbolize as what? The manufacturer of the scourge of unwell that we may see in the society. And one way or the other, we have all might have seen the impact of addiction in the society. So by using the evidence that exists to show what people are, what exactly it is, it's not about the wrestling, but it's about presenting the facts to those people, and that helps people to see, oh, this is what this represents. And I continue to go in this way, that when they target me as the product, they don't see me as the individual I should be, but I'll be targeted as the product, as they are the products that just made they see, because they need to use me. I need to use this product, ruin my life in order to achieve it. Then this is very vital for us to look if we want to change attitude. So what this thing represents should be at when we are bringing this information. And when we are talking with those risks, and those people are very vital, that we should not forget that these people might have had some information before. So when we pass the information, that's why the conversation must be there to bring the evidence forward, so that these people can and think, ruminate in healthy ways, so that they can reflect, so that with time they can be able to identify with the facts, with the correct reasoning, so that change, respond the right way towards the third rules that we need to follow if we want to bring out about evidence-based addiction prevention advocacy is to frame the conversation as a health issues, as a well-being issues. So talking about substance use as a health issue, put it in the context that our society has learned to view positively and openly. Because if you don't do that, people might not appreciate the damage of what this brings to them. But apart from looking at the health issues, we can bring at it and look at all the benefits beyond just the physical. We'll look at the social and also look at the psychological consequences of this. And this way, people will be able to appreciate that, oh, this thing we're talking about do have real life consequences and not imagined consequences that marketing companies usually bring to people. All the self-guilt consequences that bring to people. For instance, there are messages that will say it's irresponsible drinkers that cause most of the come for alcohol. And by that way, the message is stigmatizing the drinkers who are suffering from addictive processes as a result of that substance debt. And they end up being blamed for that. But we should help them to see that no, this is not what it is. That it is an health related and they need help. So that is when we are talking for universal approach to look at things. Also, when we are carrying addiction, we should use a realistic or that's real life example. For instance, rather than emphasizing what could happen to a person who misuses or abuses substance, we should provide examples of stories from individuals who have abused substance, resulting in real life altering effects. Because the people need to know what will happen on the long-term basis. Immediate cure, people might not know. And since this is a long-term problem, because we know addiction is a chronic and long-term illness, and by that understanding, then we can show people exactly what might be the end result, so that they can know the journey they are starting might end here, and if it does end there, then it will have ruined their wealth, ruined their health, and it will have ruined their well-being. The fifth dose is to help individuals identify potential consequences that often arise as a result of substance use. And these are well known, and we have a lot of them, and it is for us to see that those consequences are based on evidence, not on our own manufactured evidence. It's very vital. And it is effective when we talk about this, how this thing affects people, how this might come about, and how it affect their daily life, how it might impact the individual personally, how it might affect the immediate significant others in their life, how it might impact the society. When the people can see this throughout long run, because when their mind good consequences of pro environment to their meso, to their exo, and to their mouths, rather than pro environment, then it will help them to appreciate the challenges of what this is about and their conscience. A myopic view of it, thinking is inconsequential. Like has been pointed out, we should engage, because when we talk to individuals, whether young peers as messenger or an adult, they respond well when they have their peers talking to them about this. So it's about doing in that peer so that they can carry an effect, so that they can see that this is somebody of my thoughts and it's guiding me to do the right thing, and it's worth doing, because this is part of way positive peer influence, positive peer pressure can work, and to leave them to chance when they. And we should also remember, when you bring people who have gone through this content, their first stories often engage individuals than just to make the necessary. This is because the people are present coordinated evidence significant, and this is what might happen if people first listen or do the right thing. And we might succeed if we try to follow these 6 rules. And the 7th and 8th rule, which is also very vital, is that whenever we are talking about addiction prevention, we should not glamorize substances, which we might mistakenly do at times. Because at times, when some people are going about talking about addiction prevention activities, they tend to demonstrate the process of using those substances. Demonstrate it, a kind of increased curiosity in these youngsters. And when that do come, then it can become counterproductive, the message we are bringing. Because by doing that, we are glamorizing and maybe we are marketing what addiction prevention is, because we are bringing all the processes, the cue for those people. And that way, they will see it, oh, this is the way to do it. And that is usually not it. So we should try not to glamorize substance use. And especially in the youth, the message will emphasize the outward effect of use, including the damages to their physical health, like teeth, their breath, their skin. And no, people who use drugs, they don't even know that their breath is bad. They don't even know the consequence of this on their health. But we know and we should let them know so that they can see the need to take personal responsibility to take care of their about the dues of evidence-based addiction prevention advocacy is to carefully avoid stimulating the appetite of young people and their curiosity when we are carrying out addiction prevention campaign. So avoid using repressive and prohibitive approach as the only solution. Often some people try to shame, and by doing that, it's a repressive way and it can be counterproductive. The frequent mistake of stigmatizing young people using it as if they don't have something to contribute to the community, often can also fail. And we should try to be non-judgmental, because when we judge people, we bring this into it, we are bringing bias, we are bringing prejudice, and by this way, we are disrupting the communication processes we have tried to achieve. And that way, we hinder the right decision for these people in order to get out. We should try to frequently describe what substance use is like and what to do to avoid using. So we should be able to guide them. If you need further talk, if you need further assistance, this is the right place to go, and not to go to peer who may be using that, but to go to the right peer and come to the right professional group to get the needed help. And we should be able to guide on how to deliver anti-substance messages directly for it, because if we are delivering anti-substance messages directly without mixing it with indirect messages, they can be counterproductive. I do say we can glamorize it in the process, and that can bring trouble. So we need to watch what we about anti-substance messages in order to carry it out in an effective way, so that it will not lead to promote, but it will lead to prevent people from starting their and ruin their health, and ruin their wealth, and they can ruin their well-being. Coming back to the other half of evidence-based addiction prevention advocacy, some don't. And these don't are very vital, because when we are dealing with people that we are trying to bring the prevention advocacy to, we should be watchful. We should try not to lecture. At times, when we carry out addiction prevention campaign, we just go there and lecture. And by doing that, we are not able to impact. We are not able to flow with the audience. We are not able to raise our self-awareness in them. And by that way, we will not have succeeded in bringing a change message to them. So we need to be very conscious of this. And the next thing is that we should not encourage sensation seeking. And this also go to tally with some of the previous dudes I've said. We should not glamorize, because when we glamorize, we'll be raising sensation seeking people. And that way, it can be trouble. For some users, they can talk. I remember my college days experimentation. Wow, oh la la, they're beautiful. Even though now I'm not doing it, but and that way we're inducing the people, we're trying to let them see the danger of what we left, of what we know ruined one at some certain point in time, and might still be affecting some other colleagues up to the present time. And we may think for them to do that might be all right, and that can be very troublesome. Another don't we need to realize is we should not use scare tactics, because scare tactics challenge some to prove that their authority figures are wrong. An individual who believes a presentation is exaggerated or untrue may ignore the meaning of the message. And that is the challenge when we try to scare people. We should rather present the evidence, because when we scare, often we exaggerate. And we know those stories that abound when people are growing up. When you do this, there's an evil spirit, or there's a boogeyman, and things like that. And when the person grow up and realize no such thing exists, or as a child was growing, no such thing exists, then the person might engage in such self-damaging, health-depleting behavior, which addiction is one of such. And we don't want so. See, scare tactics is not helpful. We should engage and not do that. And we should not illustrate or dramatize drug use whenever we are carrying out drug prevention activities. Generally, we should avoid talking about matters related. Generally, we shouldn't afford talking about matters related to addictions or drug use. Most people often, when they are asked the question, they just say no comment. When they may have the opportunity to let people, the little they know, they can talk about it. And what they don't know, they should remember the first rule of use: don't manufacture facts. Talk about it. Say the little you know, what you are not sure of, tell them, I don't know. I will look for more information and get for you. We should try not to underestimate the issue of drug use. And some people might look, is the drug use in my community? It's nothing. It's just about 1% of people. And they're forgetting when it comes to issues of the brain, when it comes to diseases, that's the brain. That when it comes to those things that limits the capacity of individual, even if it's just one individual, that's a big trouble for that individual. And that's a big loss to the community, because the potential of that person might be missed. So we should not try to underestimate the issue of drug use. We should try not to use judgmental approaches, like I don't think anyone use substance in my area. When we do that, then we know, people can know this is just a liar. I can say nobody does this. We should try to avoid that. We should not neglect addiction prevention education whenever we are engaging in any youth activity or program. If you are called to come and talk about well-being about youth, you should know one of the things that can hinder their well-being is to use addictive processes or addictive substances. So we should include it as part of the talk. When we bring forward to come and talk about stress management, we should know one of the things that can worsen stress, or that can bring about stress, or one of the wrong way people try to cope with stress is to use drug of abuse. So we should not neglect bringing that up so that people can appreciate that the impact of addiction is not limited, or it can affect so many facets. And we should try it not to give detail on addictive substance when educating younger children. This is very vital because there are times most of the people who are trying to go and talk to, that were trying to advocate to, that were trying to bring campaign programs to them, they might not even know what these substances look like. And when we take it to them, we are the one increasing the curiosity in them. We're bringing this towards them. And by making this mistake, we're inducing them to start looking for, oh, where is that thing? I've seen the way it look at, then I'll go and look for it. Let me try it and see whether it may do. And this is very vital because whatever we present, we should know it's age sensitive. So it must be age appropriate and we must communicate at the level of that. So quickly, just to bring it towards that, so remember that what should addiction prevention campaigns sound like? Evidence-based have shown that if you want to talk about certain things, there are ways to put it. Like, for example, in the related, like the Cambridge Prevention Coalition, they made this. You might hear things, and even some parents say that alcohol and marijuana aren't that bad or okay in moderation. However, substances like alcohol and marijuana are especially dangerous for teen brains, which are still growing and developing until about the age of 20. This is a scientific fact, and it was put in a way that will make them to appreciate the message. And this message obeys the rules, the do's that we have and the don'ts that we'll talk about, because it did not glamorize, it did not dramatize, it present the facts so that people can see, and it's actually sensitive to the area where this message is coming from. So it's very vital that we should see whenever we're bringing our messages to people, we should make it sound like this. Another example is from the Massachusetts Department of Public Health, and this is what they say: inhalants are gases and vapors from products used in homes, offices, and schools that are inhaled. Because they get into your lungs and blood so quickly, and because they are toxic and pollutants, they can damage all parts of your body. When people use inhalants like drugs, they are really poisoning themselves, and this is based on facts. And when you present a fact like this, and it shows that you are following the evidence to bring about this. Another short ones are this, like alcoholism is the only legal disease sold in a bottle. Look, alcoholism is the disease that comes after consuming alcohol for a long time. So if selling it in a bottle to people, then it can bring about disease. And that's why the legal statement comes like that. Another is to look at the World Health Organization. From what Zachary Knight said, another to look at the World Health Organization that said that smoking is the leading preventable cause of death in the world. And this is based on evidence. And these evidence are very vital because the two most common substance use in the community is alcohol and cigarette smoking. And all these are known, and these are based on facts. One of the favorite way I call addiction is to say addiction is a long time abuse of the user's brain by the psychoactive substance or adipose. I find this definition I give that it rhymes with a lot of people to be able to flow, to appreciate what it is. Than for me to use the typical jargons I may talk with when I'm, let's say I want to give a lecture to peers like you, who are my peers, or to say a medical student, or to say professionals there. I may use those jargons that we use. Addiction is a chronic brain disease. It might not make more sense to them, but if I break it down, this is why I like to use something like this. It did carry the message, and addiction prevention message should sound like that when we're trying to define what addiction is for people. And one of the most favorites I like about it is the group of NGOs who support the UN International Drug Convention, and they come to pass the message that prevent, don't promote. This cliche tells a lot about what addiction prevention campaign should be about and how it should sound like. So whenever we're bringing out any message to the people, to the community about addiction prevention, and we'll find that no matter what we are promoting, then we know our addiction prevention campaign is likely to fail. So we should remember, prevent as it we should not promote. This is very vital, and this can summarize all the 8 rules and the 5 don'ts presented earlier on. So, to further drum home what evidence-based addiction prevention approach should stand like is to look at it that this cut across the lifespan. And so when we want to talk with people who are much younger, from age 0 to age 7, there are certain things that may grow and may become more complex for them along the line. That we talk more about healthy and unhealthy foods, about decision making, about drug use. This is very vital. Instead of showing them this is what cocaine look like, this is what this look. That increases security curiosity to use, rather than for them to get the message. When we're talking about people between the age of 7 and 13 years, then they know they have seen people who smoke, them have seen people who drink alcohol. Then we should let them know about family rules, saying no. And this way it can resonate with them and help them to see. And that way they can appreciate the challenges that may come, the problem of use, and the health and the benefit that may come from not engaging in this way and engaging in these habits which can ruin life. And when we are talking between the age of 13, which is the teen years, the early childhood, and now with labor, when we're talking at the teen years, we should be teaching them about conflict resolution, how to take responsibilities, and how to say no when they were introduced or try to be influenced. And that's why it's very vital to see that our message reflects this. The intervention we're bringing reflects this. And it should sound to what these people need there. And we should help them to appreciate at this age period that peer pressure is not the problem. It is what role is the peer pressure serving for are you serving a good purpose or a negative purpose for the individual? And by that way, that we know, talking all the time that peer pressure is the problem. No, we have good peer pressure and we have the negative one. And how we use this will entail whether we help the youth to engage in the right one, so again in the positive one, to engage in health promoting one, and that will help us to drive up the message. And when people are there within the age of 17 and 20 years, which the brain is still developing but not fully developed, we help them plan about the future. We help them know the dangers if they do fail to obey the rules. And one of the things that can challenge them not to fail is to use drugs, but that can ruin the future plan. That can limit the ability to say no. And that can worsen and increase social burdens on them, so that their conflict resolution, their coping capacity will be drained, and they will easily fall prey to this. And as we go on, we can talk more about the effect of about taking responsibility for youth. We can look at, and this tells us that addiction prevention programs, advocacies, is not a one message thing. It's a message that when we pass, we'll look at the appropriate age and we should know the goal is to prevent, not to promote. So moving on, I'm almost rounding up my talk. Moving on, what are the things we should focus upon? And this is guiding us to say that in order to do successful addiction prevention campaign, these are the things that serve as the denominator, serve as a major thing that when we focus upon, we're likely to succeed. So focus on addressing specific problems of what addiction is and what are the problems that come from it. We should target specific motivable risk factors when it comes to addiction use. And that's why teaching people about coping skills is modifiable. And when people learn the right thing, they can learn to say no. We should make advocacy approach comprehensive. And that is, they must be data-driven. It must be based on evidence, scientific evidence. We should use multiple intervention methods. We use both universal, indicated, look at it, and we should be more creative in our approach, and not forgetting that we should prevent and not promote approach. And we should design those interventions so that they should reach the individual, the peer, the family, institution, society, through multiple outlets, including traditional and social media. And on this one, I want us to also be aware that if you feel that what I've said might not have resonated well, you should know some public health organizations exist that are doing this and are utilizing this. They may not emphasize this. You may not see those roles, but this is part and parcel of what they bring together. to guide people, and ISSUP is one of them. IFGC is also one of them. The International Freedom Green Christian is one of them. One of the NGO I'm working for in Nigeria, Green Christian Air Development Initiative, is one of them. And Dr. Martin is also running GISA. So all these are NGOs that are doing this. DPF is there, some, and all this, and we have many more. We'll try to follow the evidence to bring about prevention. So in summary, if you want to successfully bring about an understanding of addiction for prevention, we should never forget whatever we do must be supported by evidence. And the advocacy of campaign should not forget 4 elements are very vital when we talk of addiction. What does addiction process do? They stimulate people. So our campaign should not forget that. What did addiction do? They let people form habits that are not good. And the habits were formed in a context. So addiction prevention should look at that, how the habits were formed, the context in which the habits were formed, the social, the political, the economic, the cultural, the spiritual. And we should look at inflexible things like rituals that people with addiction about, and that's why demonstrating, glamorizing addiction and dramatizing it. We are trying to look at, and that's why our campaign should look at that. And it's a habit we don't want people to form, and we should not emphasize on that. We should also look at the third thing when it comes to elements of addiction in the community, and that is the conditions that are in place that may make the availability, affordability, and the cultural things that people associate with it to strive in the community or to reduce them in the community. And we also look at personal issues like issue of self-control and the characteristics that rally around them. And lastly, what are the consequences of use of this? It's very vital because when we look at what the addiction is about, which is a reward in craving that keep the cycle of addiction going, then we should know our addiction prevention campaign should prevent people to see that they don't get to that level of craving for it. So that way the consequence will not be for them, it's not be them. And we should also look if there are harms, these are what it is likely to do. What are we going to do about that? And in summary, to say that by following the do's and don'ts, we can create effective addiction prevention campaigns that resonate with our audience and drive meaningful changes. So in conclusion, addiction prevention is about language, and it matters how we use that language. And that's why what I've talked about is the rules that should guide the language you use and what you should do about. And this slide tries to give us a good, when you come, say this, and when you don't say this, so that we don't get people into the wrong habit we are trying to prevent. So I will thank you all for being attentive and for participating till now, and to realize that utilizing evidence-based addiction prevention advocacy is a large part of eliminating the wide range of negative health consequences, addiction and related problems. Thank you very much.
Thank you so much, Dr. Abiola, for that excellent presentation. I know there are many questions, but because of time, I will not be able to highlight some of the key points from your presentation. I also want to believe that the attendees have benefited greatly from your words of experience. Let's see how many questions we can take within the limited time. So, Chikeme, please take the Q&A session. I will please request that ISSUP gives us about 5 minutes extra to be able to attend to some of the questions. Thank you once again, Dr. Abiola. Chikeme, over to you, please.
Okay. Once again, thank you so much, Dr. Abiola, for that insightful presentation. We have this question here. Please, what are the addiction medication used in Nigeria, and what are their prevention? This is coming from Ibrahim Abari. Hello, Dr. Abiola. Can you hear me?
Hello, I can't hear. I can hear you now. Yes, I can hear you now.
Okay. Oh, let me take the question again. Please, what are the addiction medication used in Nigeria and the prevention of, how can we prevent those addictions? Maybe if I get the person correctly, what are some of the medications that people get addicted to in Nigeria? What are some of the substances people get addicted to in Nigeria? And how can we prevent some of those substance addiction?
Thank you very much. I know I'm looking at it because what is the broad term of what medication imply? If it's used to typically prescribe medication for treatment of people with some ailments, yeah, that is good. Some of these medications are not addictive, but some of them are addictive. For instance, like the opioids, the opiates in the community. We use them as sedative for certain kind of people who are suffering from debilitating pains. But at times, some people also have them through some illegal means. And when those things are available, that can constitute some of those addiction medication. Maybe perhaps that's what the individual is looking at. Some way to effectively control them is to look at those two harms when we look at addiction control, to look at the arms of supply and look at the arms of reducing demands. What I've talked about today is to talk about that arms of demands, to see how it can do to reduce people from trying to use them, even when it's available to them. But the arm of supply, which I've not mentioned about at all, that is where some government agencies are specialized, like the NDLEA. That is their area of specialty, and that's one of the things they can do effectively for us, so that they can help us reduce the availability of this in the community. But because when people don't have access to them, that's also another way to prevent them. And this will go a long way. I know a few pharmaceutical company can produce this in Nigeria. So most of these come through illegal trafficking into the country. Like for instance, some are produced in South Africa, some are produced in Western country, and they are moved into the country through either routes of the air, and some might be come through the sea, and they are trafficked from some other transshipment process. They are trafficked from some other smaller West African country with lesser routes and due to our porous border to the country where the large population is, and that way people have access to these substances. So I believe that the supply arm can help us reduce the availability of them, so that the people actually have this thing have access to this. Hope this help in a small.
Okay, maybe we'll just take one more question before we end it today. And this one is coming from...
Sorry, let's see whether we can take two.
Okay, that's great, sir. So this one is coming from Grace Saint. The message for those who have used and those who have not used, using culture. How do you use campaign strategy? For example, the place where alcohol is tolerated.
Thank you very much. This is tricky, but that is the beauty of prevention campaign, especially in those kind of community where people use and people don't use, and the culture is permissive to you. As a universal prevention works. And if you look, one of the first rule is talking about what? It's talking about using facts. And it is when you present facts, that's when people can get the message, because they are among what we call the legal drugs in the community. Government draw tax from them. So it's availability is there in the community. But when people learn about the harms it can come from, for instance, some of the facts for several years ago, there are some misnomer of some level of alcohol might be good for health. But until about 2018 or so, when the scientific community come equivocally to show there are no level or amount of alcohol use is safe for health, because it's very vital for people to get that fact. So when people get the fact, the idea that, okay, I'm a social drinker or this will be enough for me, we know the damage comes gradually, and people will start small. And before you know it, they may get to dependence, and now they can suffer the consequence of it. So it's good to know the facts about what these products were. It's good to know the fact of what the consequences of using this product are. And that way we'll be able to help the people in the community to talk about it. And that's why I'm giving those 4 elements that when we look at what did this product do to people, it's in a way tie people down, it's a way enslave people to it. And because it's money making for other people. So the people using a commodity for the people who are producing it, they get richer. While these people are going down, their health is going down, their wealth is going down, and they keep drowning in the suffering of what the addictive process is. So it is good to see that the person wants to do this, learn enough what the act of scientific fact is about, to be able to go there and pass the scientific fact. And when it follows the rules, those do's and don'ts, then you will know, it will not dramatize, it will not be judgmental, it will not glamorize. And when it follows some of those rules, it will help them to see. And it will not come there to shame people. It's there to pass a message. And that way the people will be receptive to the message. But when you try to shame them, you try to make them to scare people, then the message will not be passed. That fact will not resonate with people. And I think, like you said, time, we still have one more question. Let me stop it, but I hope this may guide the person to move in that direction and push forward. Thank you.
Okay, yeah, thank you so much. We have this one coming from Odeon Pestis. Is there a working drug harm reduction program in Nigeria? What are the criteria for assessing it?
Okay. I cannot tell you categorically if there is a working harm reduction in Nigeria. I know it's part and parcel of a gateway advocated for as a way towards abstinence, that you help people to start reducing the consequences of using this drug through an harm reduction process, so that you can push them towards abstinence. That's one of the goals that are started. But how it is used or how it is preached, then those are the trouble. There is difference between what the scientific community understood as harm reduction, as different from what the social movement that are campaigning for harm reduction look at it. Because there are some people who are harm deniers in a way, but they call it harm reduction. So if you follow the campaign of people who are harm deniers and telling people that this is what you should do in the name of harm reduction, then someone will be misled. So it's very vital for someone who wants to go through harm reduction to understand, or to want to do it, to understand what the scientific community understood, the International Society for Harm Reduction, what they say. Is very vital, so that we don't fall into the social movement talk, which are not based on scientific facts, but they have beautiful names, they have beautiful messages that people can get really in it. So following what the scientific fact is, it will help the individual to go through. I know there are concerted efforts by the Ministry of Health to make available some of this replacement therapy that can be used for harm reduction. They are available, but how will it be practiced? Who are the professionals that are with it? Have gone a long way. I also know that the UNODC, in collaboration with the Ministry of Health in Nigeria and other people, have been training some people in order how to use some of this treatment replacement therapy, so that it can be used the right way. It can be monitored, and people can follow through to what it means like, so that the goal of the therapy will be achieved, and not to turn people to just replace one form of addiction to another form of addiction. Okay, I'm not taking this, but I'm taking something like it. The person is still addicted to it. The goal of harm reduction will not be achieved. We are always switching one form of addiction for the other. So it's vital to understand exactly, essentially, what harm reduction is, because that way will help people a lot to see that they achieve the movement.
Thank you so much.
This help in a way to guide people in the right direction. Thank you very much.
Okay, I think this is the size of the questions we can take for today. So I'm handing over to Dr. Martin for the conclusion of the exercise.
Yes, thank you so much, Yukeme, for taking us through that Q&A session. Just before we sign off, let me also add to the last point by the speaker on harm reduction. I think the point the speaker made, or part of it, is that the goal of harm reduction should not be misplaced. As a policy, harm reduction protocol has actually been launched in Nigeria, but the goal of harm reduction should not be misplaced. In other words, people should have a good understanding of the concept of harm reduction, so that at the end, what the harm reduction stands for should be achieved and not misplaced. I think that is the caution there that I can deduce from the point by the speaker. So once again, thank you so much, Dr. Abiola, for this insightful presentation. And I want to believe participants, attendees, I would say, please, for those who ask questions or who send questions and we're not able to respond to, apology, this is the much we can take. Time is not always our friend. And I want to encourage you to join us again in September. We shall be having another webinar. So the date will be communicated soon. And please look forward to it. And we want to say thank you for being part of this session and look forward to seeing you again. Thank you, everyone. And thanks to ISSUP Global for always supporting us. Bye for now.
Bye. Thank you, everyone. Thank ISSUP Global. Thank ISSUP Nigeria.